Hey, Steve Lynch here at Limestone Therapeutic Massage in Newark, Delaware. And you can reach me here at stevelynchLMT.com, or you can reach me at limestonemmassage.bizor.com. And the reason for this little chat today is I want to talk about something that's near and dear to bodywork, and that is fascia. And you might well ask, well, what is fascia? And why is it important to me? And what's its relativity to body work? Well, fascia, for lack of a more technical definition, is kind of like saran wrap, but for the entire body. Fascia will cover your bone in the form of periosteum. It'll cover your muscle tissue. It'll cover your tendon sheaths. It'll cover your ligaments. In fact, even your internal organs hang off of thick fascia called meninges. And the purpose of fascia is not only just to keep things wrapped up and tight and compact and not flying apart, but fascia also does a couple of other things. It filters out impurities in the bloodstream. It also keeps those moving parts like the tendons and the joint structure and the muscle tissue. It keeps it moving. Where we would slide, muscle tissue would slide across and tendon would slide through the sheaths. If that fascia becomes inflamed, well, we've got a sticking thing happening here. And what can happen then is you can have what we call adhesions. Adhesions are when, say, we've got an injury in a certain portion of our body, the muscle tissue becomes inflamed, there's swelling that takes place, waste in the form of lymphocytes can remain there, and eventually it can even lead to calcification between the fascia and the muscle tissue, in which case you got some real problems. But having good, slippery fascia can also affect your everyday life and the way that you're able to move about and navigate through your everyday chores or, say, athletics. I mean, it's very, very important for athletes to have good fascial slip when they're trying to achieve great things in their sport. So this becomes very important to everyday people and athletes, and it becomes an important issue for body workers. Now, if you can look behind me on that chart back there, all of those white areas are fascia, and there's more fascia than you can see reflected on that chart back there. It's deep inside the muscle tissue, like, say, for instance, in the thighs. It surrounds everything, so it's compartmentalizing different muscle structures. And there are techniques such as Rolfing or neuromuscular therapy, structural integration techniques that your body worker can use to actually get into the deep fascia and make sure that that's nice and loose and slippery like it should be. But also you can talk to your body worker who normally does your body work, and you can say, hey, I would like to have maybe some skin rolling is very good, and some nice fascial tugging in your treatments to be able to loosen up that joint structure, to loosen up say, like the thoracolumbar fascia, which, if you look back here, all the way back here, yeah, there it is. That fascia right there is kind of a triangular type of fascia that wraps all the way from the mid-back line there all the way around to the front, and you can see that reflected on this guy. There's a lot of white fascia around the abdominal area and the pelvic area, and it wraps around the back. So if this becomes stuck together and immovable and there's adhesion, that can be pretty problematic. So we want to, at all costs, we want to make sure that our fascia is nice and slippery, there's not adhesions, and we have a smooth interaction between our muscle tissue, our tendon and ligament, and that fascial structure. So That is the importance of fascia. And I'm Steve Lynch at stevelynchLMT.com. If you have any more questions, you can shoot them to me. If you have a body worker that has some knowledge and some good hands, you might want to get them to check out your fascia and make sure that you're moving and grooving just the way you should be. And life should be sweet like that. Okay, have an awesome day.